My name is Sam, and I'm a special education teacher. My daughter, Katie, was 5 years old when she had her first urinary tract infection. And when she first got sick, she had a high fever, stomach ache, vomiting. We took her into the doctor, and at that time she was diagnosed with a UTI. And I didn't think a lot about it. I just thought, it's a UTI, we'll take the antibiotics, go on with life, no big deal. But it didn't turn out that way. It kept coming back. She took a round of antibiotics, a 10-day course, and then within just 2 to 3 days of finishing that course of antibiotics, she had the same symptoms once again: high fever, vomiting, stomach pain. We took her straight back in, and again, same test. It was a UTI, and at that time, I again wasn't too concerned. I just thought, well, maybe we didn't have the right antibiotic, or it just didn't get cleared up. We'll do another round, that'll be it. And then that didn't happen either. As soon as that round was done, again, within a few days, she was sick again. And we're talking fevers 105 degrees routinely, and then just vomiting a lot, and just a lot of stomach pain. She couldn't go to school for a while. So when Katie got her third UTI, right back-to-back UTIs, we realized that there was more going on that we had realized, and we were very concerned that there was something going on in her body that would cause damage. My mom is an ER nurse, and she recommended, and she was right on, that we needed to get a referral to a pediatric urologist. And at that time, we asked our doctor to send us somewhere, and we were sent to Dr. Kirsch's office in Atlanta, and that was the best connection we could have made.
So Katie is a 5-year-old little girl who suffered her first urinary tract infection approximately a year ago. Her urine culture grew at E. coli, which is the most common organism that we see on urine cultures. As part of her evaluation, she underwent a renal ultrasound, and that was done locally, and that showed that she was reportedly normal kidneys, but upon further review, it was found to show that she had a small kidney on one side, quite smaller than her opposite side. And because of this, she underwent a voiding cystourethrogram to evaluate whether or not she had reflux.
That's a procedure that is a big deal for a small child to go through. But it also required the specialists that they have in Atlanta to perform it. They set us up that same day. They called us the same afternoon with the results of the VCUG and said that, in fact, Katie does have VUR, which is where her urine was refluxing up into her kidneys and causing the infections.
This study showed that she had low-grade reflux on both sides. And so at that point, we discussed all the treatment options, and the family wanted the least invasive procedure that would offer a good success with the lowest morbidity. And so we discussed open surgery versus endoscopic injection with deflux versus robotic surgery. And the family ultimately decided upon endoscopic injection with deflux.
We chose deflux. It was a simple procedure. We researched it. My mom helped us research with her medical background. We chose it because it was simple and it offered very good results from the statistical data that we could find, or that Dr. Kirsch's office presented with us. And we were also uncomfortable with keeping her on antibiotics.
So when the parents are looking at these different scenarios, they really want the least invasive, shortest follow-up for their children. And in her case, doing deflux injection got her to no reflux the fastest. It also decreased her risk of having an infection the fastest. And so it was really an easy decision for the family to make regarding her treatment.
Once we had made the decision to do the deflux procedure, and it was an easy decision for us to make, we were back in Atlanta within the month to do the procedure at the hospital. It was very simple. Of course, it was through a children's hospital, and the staff was wonderful. They treated her like a queen. They gave her all kinds of toys. But the most important part as a parent was that it was quick. It was non-invasive. There was no cutting. She was back to her normal self within a day. 2 days later, she was back at gymnastics.
And as it turns out, she had a very successful treatment. The deflux is an outpatient procedure. It takes about 20 to 30 minutes. What we do post-operatively is we see them about a month later. We do an ultrasound of the kidneys and bladder. And if everything looks unchanged, we stop antibiotic prophylaxis and see them annually. And Katie came back to me after a year. She had no further infections during that entire year, and she's likely to do very well over the long run.
Since Katie had the procedure, she's had 0 UTIs. We have been very pleased with the procedure. We were very pleased with the quick recovery and the fact that she's not been sick again. It's honestly been something that we don't even think about anymore. The procedure was over a year ago at this point, and so no UTIs since then. She's been back to visit Dr. Kirsch for a year follow-up. The examination showed that she had no damage to her kidneys. So we caught it in time. We found the right treatment in time before there was anything to harm her permanently. And we're just very confident that this was the right decision for us and for her. If another parent were to come to me with the same type of problems with their child, I would definitely encourage them to do their research, to get connected with a pediatric urologist, and to look into deflux to see if it's the right procedure for their child. It definitely was the right procedure for us. I have no doubt that it was what we should have done for Katie, and it's been wonderful for her life. And I would encourage them to research it and to find out if that's what's best for their child as well.